even though it's no longer near the 100,000 number that we had seen in between, or the 90,000 number, but many states and there are new areas. So if you were to put your finger on the one thing that state governments are sort of failing at or flailing at, what would be that?
You're asking that question particularly in terms of the health response. I
Yeah, in
think
terms of the how the public policy response has
yeah.
been.
Quite often we react, there's a lot of panic associated with COVID. The fact of the matter is that the death rates are low. They are low as a share of infections. They are low as they're even lower as a share or as a percentage of total population. So compared to other countries in the world, the fatalities are low. What is even more important is that the fatalities over a period of time have eased, meaning the figures have dropped a little bit. We are nowhere near any conceivable definition of herd immunity. So I have a feeling the infections will continue for some time before they begin to taper off. The question to ask is not about what about infections, because many infections for most people are going to be either without symptoms or they are going to be without serious consequences. So the objective has to be to concentrate on the serious cases so that the fatality rates can decline. And as I just said, the fatality rates have been declining. You are absolutely right that any lockdown simply shifts the curve to the right. It does not eliminate the disease. So, what does shifting that curve to the right help us do? It helps us to get our systems together, to plan, to handle the serious cases better. And I think what this has demonstrated, what this entire episode has demonstrated, is that some states are better at governance, regardless of what we are talking about, not just COVID, than others. And some states are not that good. I said states, but quite often in the case of something like COVID, it boils down to municipal government. It boils down to districts and municipal governments. And irrespective of which state, there are districts and municipal governments which have done extremely well in terms of testing, proper testing, in terms of contact tracing, in terms of handling serious cases, and there are other states which have not. So it flags the perennial issue that you and I have talked about and written about for a very, very long time, that there is a governance issue. That governance issue is not just union government, it's not even state government, it's local government.